Ulavanaka, I'm Louisa Turanga. Welcome to Speak Your Mind. As we've just observed World TB Day, this is the ideal time to shed light not only on tuberculosis, but also on the link between TB and NCDs. There is much to be aware of when we look at this co-infection where a person living with diabetes also carries the TB infection. This afternoon, we examine that link and we talk about the national health capacity in response to the TB and NCD threat. In studio with us, Dr. Frank Underwood, National TB Control Officer, and Dr. Isimili Tukana, Head of National Wellness Center. Bulavanaka, thank you for coming today. Now, last year, Fiji recorded a total of 358 TB cases. That was a slight decrease from the previous year. But just how many of these cases were TB diabetes mellitus?
Thank you, Lucy. Last year, as you mentioned, we had 358 cases of TB, of which about 14% were also diabetics.
Okay. So, well, today's topic is on TB and NCDs. So the relationship between that, TB and NCD, is quite complex. But if you can help me understand the link between these two.
Yeah, the world literature has found the link between TB and diabetes. You will note that before we used to link TB and HIV.
Yeah.
There is a link. And now we are moving our focus to TB and diabetes mellitus because diabetes is very prevalent in the country. That's why we need to make that link. Yeah. Just in HIV and diabetes, we find when we have these two diseases, it actually affects your defense system to diseases. Right. We call it your immunity system, how your defense against certain diseases. So just in the case of HIV and diabetes, your immunity gets low, or your strength to fight diseases gets low, so it gives your risk of getting TB gets higher. The chances of you getting TB in a diabetic gets higher. That's the link that we are trying to. So we know in Fiji we have a lot of diabetes.
Right.
Now we have to say all diabetes should come and get checked for TB because the chances of getting TB is very high in diabetes because the defense mechanism lowers.
Okay. Yeah, sorry, you wanted to add something?
If I could just add to that as well from the TB side. TB is an infectious disease. Usually it is spread by the respiratory route. And once you get that microbacterium that causes TB into your lungs, it can do a number of things. It can either become very active if your immune system is weak and cause disease right then and there, or your body's defenses can take care of it, and it goes into what we call a latent state. We call it latent TB infection. And if you have a latent infection, you have no symptoms at all. There are no signs that you are sick. So you're a healthy person who carried the bug in your lungs.
Okay.
And at a later time, when your immune system perhaps becomes weak, it can become activated and develop into disease. And that's what diabetes does. It can weaken your immune system quite considerably. Although most people who develop TB will develop it in the first 2 years of acquiring the infection, you can also develop it quite much later. Yeah. And the other thing is, they say that maybe 1/4 of the population in the world carries this latent infection. So you can understand the concern that we are raising, coming to talk about TB and diabetes today. If 1/4 of Fijians have a latent infection, and a large percent of our population are also diabetic, and you potentially have the perfect storm.
Right, yeah. For going back to NCDs, which, apart from diabetes, like, with smoking and alcohol, which other NCDs put us at a higher risk of TB infection?
Well, NCD, particularly diabetes. Diabetes. In NCD, we talk about diabetes, we talk about heart diseases, we talk about stroke, and we also talk about cancers. We talk about violence and injury. We talk about mental health. But the link strongly suggesting the association between tuberculosis and diabetes. That's the one that we are And again, as Dr. Frank has said, we've got a high 15.6% of Fijians are diabetic. And then you have that finding that 1/4 of the population have latent diabetes. And with the finding, in 358 cases they found, 14 in every 100 has got TB and diabetes. So we have two programs. They are different, NCD and CD, communicable disease, but there is a link that we need to look at. The time bomb is here, or
Right.
that environment is very is there.
Right.
That you can have. We need to find out those who have both.
Right, yeah. You mentioned two very important health issues. So we'll just go to TB here. If you could just explain the signs and symptoms.
Yeah. So, TB is chronic multi-system disease. So basically, the symptoms come on quite slow, and it can affect any organ, but the most common organ is the lungs. Yeah. Now, all cases of TB will have what we call constitutional symptoms. They will have weight loss. They will have fever, usually at night. They have night sweats, so they wake up in the middle of the night and their bed sheets and clothes is drenched. They feel very cold. They may lose their appetite. Now, the other symptoms depend on where the TB is. So if you're having TB in your lungs, of course, you'll be coughing, usually coughing for more than 2 weeks. You may cough out blood. You may have pain in the chest. You may develop shortness of breath. If you have TB in the covering outside the lungs, where fluid, water can fill up, you may develop shortness of breath very suddenly. If you develop TB of the spine, you may develop back pain, weakness in the lower limbs. You may become paralyzed. You can develop TB of the brain, where you may develop a headache that comes on over a long period of time. You may develop seizures. You may develop paralysis, or you may go into a coma. So potentially you can have symptoms for every organ. Yeah, but we usually concentrate on pulmonary TB because that's the form of TB that can spread the disease into the community, the infectious forms of TB, and the most common forms of TB as well. Huh?
Are there any high risk groups?
Certainly, because it's spread through the air. We usually say if you're a close contact, you live within the same environment for more than 8 hours, then you're at the highest risk group. The other risk groups are people living with HIV.
Right.
The immune system is pretty weak.
Right.
Diabetics, of course. Healthcare workers, you can imagine, exposed to all sorts of bugs. Yeah. Migrants from somewhere where TB is very prevalent. Okay? These are the main risk groups.
Okay. All right. Thank you, Dr. Underwood. We'll just go into a quick break, and then we'll come back and continue.
Okay.
You're on Speak Your Mind. Welcome back to Speak Your Mind. As we've just observed World TB Day, we're talking about the relationship between TB and NCDs. Well, before we can fully understand the relationship between these two, let's just break them down individually, since they're both very important health issues. We're on TB at the moment. Dr. Underwood, you were saying the high-risk groups. Just a question, are our clinical officers at dispensary level trained and equipped to pick up the symptoms?
Yes. In Fiji, our frontline health workers are what we call doctors and nurses working in what we call primary health care. They are the first point of contact that our community has with the health system. Now, TB is not a very simple disease to diagnose at times. It can be a bit complex. What I can say is that over the past few months, we have stepped up our training of clinical staff in primary health care, so that they are better able to diagnose TB. We also say, usually we tell our clinicians, having a high index of suspicion is the first step in making the diagnosis. Yeah? So to ask your question, we're getting there.
Okay. We need to ensure that TB is eliminated in the next, by 2030, that's the goal. It's a very ambitious SDG target, but how are we ensuring through policy change that this will be implemented?
Well, globally, the strategy that WHO has adopted or developed is called the NTB strategy. And Fiji has endorsed and developed our own strategies based on these. And we are confident that by the year 2020, we would have met the early objectives. By the year 2030, we would say a lot of work still needs to be done. Okay? We need commitment at all levels of the community that, eliminating TB as a disease in Fiji is a priority for all of us. For the healthcare and the population level, we have, in terms of diagnosis, what we call a patient-centered approach, taking services out to the community and the population. We have established or put in new tools that are more sensitive in diagnosing TB. For example, the Gene Expert machine, which is now in the main divisional hospitals and on 2 mobile platforms that can go out into the community. We now have 9 labs that are able to help in the diagnosis of TB. The treatment is tailor-made for the patients. It's much more easier than in the past. Treatment can also take place in the home and in the community, removing that need for, long admissions. Admissions are now shorter. From policy level, working with other programs and, special interest groups are very important. For example, our colleagues in diabetes control and NCDs, also building on the relationship we've made with the HIV program. That's also an important risk group. Through Global Funding support, Fiji has been a recipient of Global Fund to fight TB for a few years now, and part of that fund has been set aside for what we call community grant schemes. So a number of community groups in the country, NGOs and CBOs, have been partnering with the program. In return for community grants for development, they champion community level awareness for TB. So awareness levels is building from the community level, These are some of the things that we have in place. Then the preventative programs are very important as well. We have prevention available in terms of treatment for latent infections, and we've reserved that for high-risk groups like children who are under 5, children who are under 15, people living with HIV. If they are infected, we can give them treatment that they do not develop TB later on. We're looking at expanding this to diabetics who have infection because of that risk as well. Then we have programs that address, simple public health measures, covering your mouth when you cough, having a handkerchief, good cough hygiene. It's not only useful for decreasing the spread of diseases like TB, but also meningococcus, influenza, the common flu. These things need to come back. We're also looking at prevention, ensuring that the BCG vaccine given to our babies is maintained at a high level of coverage. Now, they don't prevent children from getting TB. They can still get TB, but it prevents what we call dangerous forms of TB, TB of the brain. These are things that can kill young children if they're not immunized. So it's important that parents, guardians understand this and ensure their newborn babies are immunized as well. We also work with, other counterparts within government because TB is a social disease. The risk factors for TB, a lot of them fall out of the scope of health. For example, housing, ensuring that houses are built strong and also adequate space in terms of living space and adequate ventilation is maintained. Good health and nutrition, food security. So poverty, there's an association with poverty. So working with the Ministry of Children, Women and Poverty Alleviation is very important. And all other government programs that address these things. So that's what it takes to eliminate TB by the year 2030. And that's why it's part of the SDGs. The whole SDGs is addresses all issues of health and national development at the same time.
Right. Just with I read something on a WHO report. In order to address TB, you need to address NCDs, and how we're doing that here with the fight against diabetes.
From the diabetes perspective or the major NCDs in Fiji, nutrition and physical activity becomes our key component. Just like you have BCG to immunize against dangerous forms of TB, the immunization for diabetes is actually eating, how we treat
diet.
and the diet. The diet actually, if you do it well, it actually boosts your immune system, so that it keeps you away from diseases, especially communicable disease. And even when you get sick, it boosts your system. You recover quickly. So in the context of NCD and diabetes, you need to work on the diet and as early as possible. We are having a lot of evidences coming out from children's diets not being, they are not well nourished. Now, when I'm saying 15.6% of Fijians are diabetic, I'm talking about 25 years and over.
Right.
Yeah. But now we are finding in Fiji that the diabetes we usually find in adults is shifting more towards children. And the risk factors are moving more towards Fijian children. So the meaning of that is we need to relook at our diet and nutrition on how we raise our children in terms of diet and nutrition.
Right.
You have other risk factors, tobacco and alcohol and exercise. But what we find in Fiji is that not all Fijians smoke. Not all Fijians drink alcohol or grog. Not all Fijians exercise, but all Fijians eat. And there's just lots of food in Fiji.
Right, right.
The challenge in Fiji is for us to learn to eat the proper food and a balanced diet and all those kind of learning, and it needs to be taught from young.
Right, right.
So those are the main strategic direction for controlling NCD and diabetes. We are moving more towards children.
Children.
We are saying if we start the lifestyle well, then we'll keep it away from the
Yeah, okay. So we're going to just pause right there and pop into a quick break before we head back and continue with that, Dr. Tukana.
Thank you.
You're on Speak Your Mind. Welcome back to Speak Your Mind. In studio with us, we have Dr. Frank Underwood and Dr. Simeli Tukana joining us, talking about NCDs and TB. So just going back to what you were talking about, Dr. Tukana, on our diet, how important it is with diabetes, NCDs.
Yes. How we want us Fijians to understand that diet is actually helps in the immune system. We talk about vitamins, we talk about micronutrients, folate and zinc, all those kind of things, which are good for boosting the immunity of all Fijians. We are having a problem in that area. The latest National Nutrition Survey is saying that we are eating all right. Everyone seems to be eating, but the results are showing something else. Something that we need to work on. We must remember, we must learn in Fiji that we don't lack food. Fiji is rich in food. It's just a matter of learning how to eat healthy. Food security and availability of foods is there. It's a matter of learning how to eat more healthy foods. The survey has shown that we are now moving more towards processed foods. So Fijians need to learn how to eat processed foods. You have to learn what are these foods about? What are noodles about? What's in the noodle that gives me health? Or how can I make the meal healthier with the noodles? Those are the kind of things. The research is showing we are moving more towards processed foods. While we in the Ministry of Health want all Fijians to go to organic, that's not the real picture. We need to shift in that area and think of it in the sense of how does it help my defense system to defend my body or our family life from getting diseases. So the relationship between TB is infectious. They have a vaccination or immunization system to help boost, and you give that vaccine to normal babies. In the same way, we are saying in the NCD space, you need to give the normal babies of Fijian good food, healthy food, so that it builds that. It's exactly the same concept, so that we can help each other in that. If there is a strategic direction for Fiji, for me, in dealing with diabetes, I'm talking about raising our children in the first 18 years. That to me is where the success effective on nutrition and exercise. Those are the two big ones.
Okay, thank you. Dr. Underwood, just with TB, how are you strengthening early detection or active case finding? I mean, it's very important in the management of TB, yeah?
Yeah, definitely. I think it cannot be stressed enough that early detection is key to controlling TB, especially TB of the lungs, for two main reasons. If you are diagnosed late, then the damage to your lungs become more extensive. Yeah, to the point that even when you are accessing treatment, you may either recover with lungs that are damaged, and then that will decrease your quality of life later on, or you may succumb. Yeah. Secondly is, the longer you are coughing, the more you spread the disease in the community. Yeah. So that the key is to interrupt transmission. So that's why early detection is important. Now, two things we need to look at here is the community presenting to health facilities early, and that's half of the problem. So programs like this raises, the awareness in the community. If you have contact history of TB, you're coughing for more than 2 weeks, you're losing weight, you could have TB, present to a healthcare system early, ask, can I have the TB test? Is it possible that I have TB? The second issue is when you get to a health facility, the health facility is able, the clinician, the doctor, the nurse is able to diagnose the disease. Yeah? And we're working in that space in terms of capacity building our healthcare workers, putting in better laboratory tests and x-ray machines that are able to help with the diagnosis. Yeah? So in addition to this, I did mention earlier that there are two mobile platforms. There are two trucks which has a mobile lab and x-ray on board. And we send this to communities where, a highest risk of TB exists, where we've had a lot of cases of TB in the past few years. Yeah. And we go to these communities and we do screening using an x-ray. And for those that have changes that are suggestive of TB, we collect sputum and we run a very sensitive test on the truck. We should be able to give you a diagnosis within 3 hours, 2 to 3 hours. Yeah. So that increase in accessibility to the communities is also key in getting an early detection. Yeah. But I would stress to the community, the public, if you have signs and symptoms suggestive of TB, you've had a family member or co-worker who has had TB, you have diabetes, the chances of you having TB is high. Seek care, ask the clinicians or doctors and nurses, I might have TB, can you do the test?
Okay, so I can visit my health center and ask that, and they can do the test right there and then?
If they are not able to, they can refer you to where they can do the test. Okay. They can initiate the process.
Okay, yep. Okay. All right. Just another question. How is the Ministry of Health working with other stakeholders and other ministries? Just going back to the other, to help combat this in terms of poverty alleviation, improve diagnosis and treatment?
Yeah, maybe I'll use this opportunity to talk about something what we call catastrophic cost.
Oh,
yeah? Okay. TB is a disease highly associated with poverty or poor socioeconomic status. Last year, with WHO, the National TB Program and the Ministry of Health conducted a catastrophic cost survey where we surveyed 226 patients and determined if they had faced catastrophic cost accessing TB care or after diagnosis while they were on TB care. Now, catastrophic cost is defined by the World Bank as if in the course of seeking and receiving TB treatment, which can go for 6 months to 12 months, more than 20% of your combined household income is spent on the disease. And you may ask, hey, isn't this health services free? Or why is there catastrophic cost? Yes, true, TB treatment is free, but these are the costs associated with accessing care, transportation, and while on treatment, if they're admitted in hospital and they're in a form of employment or where, if they don't report to work, they don't get paid, then that largely impacts on the household. And the preliminary results show that 40% of our population's TB patients faced catastrophic cost. And our concern is that one of the earlier 2020 targets for WHO is the elimination of this catastrophic cost. So going from 40% of our patients facing some catastrophic cost to zero is going to be a challenge. And that's why we are starting to work very closely with the Ministry of Children, Women and Poverty Alleviation to see how, they can inbuild programs that our patients can have access to. So during that period, they are supported. Yeah. As well as I mentioned earlier, working with agriculture and food security, working with Ministry of Housing, Urban Development and Planning, looking at how we design informal settlements and how we can, raise the standard of economics in these areas. As the GDP of the country rises, the rates of TB also falls. They have found that once GDP rises and community wealth improves, levels of TB also falls. Yep. Okay. Yep. So as people get wealthier, maybe Vuniwai can correct me, maybe they eat more nutritious or exercise more. Housing condition may improve, spread of diseases may decrease as the number of people in a house falls. Yep.
Right. Okay, we're going to be back in a bit. You're on Speak Your Mind. Welcome back to Speak Your Mind. I'm Louisa Toranga, and with us in studio, Dr. Frank Underwood and Dr. Simeli Tukana. We've just observed World TB Day, and our theme for this year, Leaders Wanted to End TB. Dr. Underwood, can you share more about that?
Actually, when you asked about how the program is engaging, or the ministry is engaging with other stakeholders, it really ties in with that World TB Day theme, Leaders Wanted to end TB. It's not often in the history of medicine that we get to an opportunity to eliminate a disease. That was achieved with smallpox in the late 1970s. Could be achieving that for polio soon. And it's possible that by the year 2030, TB can be eliminated. But it takes the entire effort of the whole community. Yeah. So leaders are wanted from, politicians to heads of local government to heads of community leaders, traditional leaders, heads of families. In the classroom, we need students to stand up and say, yes, I'll make that effort to be a leader, to lead the charge to eliminating TB. Patients, healthcare workers. So basically, everyone needs to put their hand up and say, we can do this together. Yeah. So the key idea behind that message or that theme from WHO is mobilizing community support across the board. Everyone has to do this. Yeah. What the space that Ministry of Health has to do this, we've always had this space. This is the oldest disease in history, and in Fiji, the TB program was established in 1950. So it's a very old public health program, and we've got the incidence rate of TB down to a certain level. But to get it down to elimination, where we have less than one case in a million population, so maybe less than one case in Fiji, by the year 2030, we'll take a community-wide effort. Yeah.
Okay. Dr. Tukana, with diabetes, diabetes and TB, like if we don't, in a few years' time, if we don't address that problem now, what does it mean for us and, the cost and everything?
Yeah, first of all, WHO is saying in 2030, no matter which region in the world you live in, there are 6 WHO regions in the world, diabetes will increase, NCDs will increase. So hearing that, it gives us more challenge to start thinking about solutions because it's the leaders in World Health are telling us it will increase. What we found in Fiji, we've managed to reduce abnormal sugar levels from 16.5 in 2002 to 15.6 in 2011. So there's a plateau there. But we are having problem with the risk factors, just like the social determinants. We're having problems with nutrition. I know we have a significant amount of poverty in the land. Dr. Frank has just said if we have an increase in GDP, hopefully that will mean more Fijians have money in their pocket to afford the healthier options. Those are the kind of things. So you can see that it is really outside Ministry of Health and Medical Services. We need people in the community to really help us or to lead the fight against diabetes or any diseases. The only other thing that I think it's important for Fijians to note now that we need to increase our level of health consciousness. We need a society that says, okay, my car gets checked every year. You go for check every year after a certain mileage. We need to help all Fijians and help each other to also say, okay, every year I need a health check because of the situation we are in. And health check means you get checked for diabetes, you get checked for TB, you get checked for all other diseases. The chances are, as a Fijian, you are most likely, if you don't get checked, you are most likely to have more than one disease in your body. And you do need to annually check it, just to make sure, for two reasons. One, just to make sure you are well. And number two, we say if it's detected early, it's easier for us to treat. At the moment, most of the struggle we're having in the Ministry of Health and Medical Services is you just present too late to the ministry. It's not a habit. We wait. We are trying to change those kind of thinking among Fiji, and we need a collective effort. We are saying from the hospital side, you are presenting late. Sometimes it's difficult for us to treat. TB is treatable. Diabetes is treatable. But we need to work together to help us in the treating. So we are also moving to social determinants, housing, poverty. These are issues. Women, children. These are the sort of issues that we need to move on to in our national effort to reduce disease.
And what programs do you currently have in place to address NCDs to prevent TB, like with the...
we have 4 levels. Number 1 is we promote wellness. And we say there are 7 lifestyles to wellness, and that's what we promote at the at the settings level. So we have 7 settings. We go to communities, settlements, we go to municipalities, we go to schools, we go to faith organizations, we go to workplaces, and we use sport. So we promote wellness there. The second level is screening. We screen people at these settings here with the objective of trying to keep Fijians well, keep them well, and coach them, and to also, more importantly, to pick up those early cases, early birds, so that we can treat them early. The third level is those ones that we pick up. We have what we call a special outpatients service, where we look after them, and we do a lot of motivational interviewing to try and change their lifestyle and shift them back. Or if we cannot change their blood results, we shift them up to specialists very fast so that they can come in. And last but not least is a monitoring and evaluation. We are not only treating patients, we want to make sure that they are treated. It's different from TB, it's treatable. For us, is the control of blood glucose is our aim. We really may not be able to eliminate it, but we can control and make you live longer and healthier.
Just on people living with diabetes who have been have been amputated. Do you think we have our infrastructure and everything is friendly towards that, and they come out and...
That's a challenge. I think government is well aware of that. It has done some moves in terms of looking at disabilities. They enter into that space. So we are happy that government is moving in that area. You have a Fiji Council of National Council of Disabled Persons who are moving in that, and lately you would have heard government talking about supporting more support to people with disabilities, and that includes amputees.
All right. Thank you, Dr. Tukana. We're going to come back in a bit. You're on Speak Your Mind. Welcome back to Speak Your Mind. In studio with us, Dr. Frank Underwood and Dr. Simedi Tukana. We're talking about TB and NCDs, the relationship between these two very important health issues. And we're going to wrap things up in this segment. But yeah, just talking to the two doctors with diabetes and with TB. What is the ministry doing to encourage behavioral change?
Okay, a few things. The main strategy that NCD is using is we're finding it's difficult to change behavior, but it's very easy to create behavior. So we are moving more now towards those who are stakeholders in creating behavior. Number one is parenting.
Right.
As I've said, the key to dealing with NCD in Fiji is looking after children from pregnancy, the first 5 years. We call it maternal child health, our school health, and adolescent. We need to look after them there and ensure that there's an environment that is created that make them that promotes healthier lifestyle. So the parents is the key one. The other two institutions that we found that influence behavior are the community. We call it a Vanua. So we are working more towards provinces and the social structures in Fiji, because we believe they are quite key to creating good behavior. If they learn about wellness, they're more likely to promote. So we are moving in that space. And the third one is the faith organizations. I think faith organizations are key to most of our behaviors are faith-based behaviors. So these are the three that we feel are key to behavior change or creation of good behavior. One is parenting in the first 18 years, and see how the community structures, social structures, and the faith organizations can help in that area. So we are going out a lot and reaching the people with a wellness message on how to create and sustain wellness behavior and have a health-seeking behavior, so that you can come to us faster than what we're doing now. You're just coming too late. We want to attack faster, and we need that collaboration.
Yeah, from the TB point of view, it's quite similar. Number one is the health-seeking behavior. So before you access care, as soon as you get sick, come early so we can diagnose it quicker. The second is once you've been diagnosed for the individual patient. It's a long journey. TB is curable, but it takes treatment for 6 months to a year, and even up to 2 years if you have a drug-resistant form of TB. So having our patients been motivated to take medicines on a daily basis is the challenge, Getting someone to stay on medicines when they start to feel better, that's very big, But, at the individual level of the patient, we tell them, being diagnosed early, completing your treatment, you're also not just reclaiming your life and your health, you're also protecting your community, because infectious TB untreated spreads disease. And then the third space is communities themselves. They can be barriers to patients accessing care and taking medications, especially through stigmatization. TB, unfortunately, has been one of those stigmatized diseases in the past. And I always say when I get a chance that stigma surrounding TB should always remain in the past, because it's a curable disease. Treatment success rates are very high. It's not a hereditary disease, as sometimes people, say, and that causes the stigma. And that acts as a barrier for people coming forward, That needs to change. And that's what some of the works that we are doing at ground or community level is to also decrease that level of stigma.
Okay. Just with diabetes and how expensive is it to treat? How much does this cost our economy?
Well, once you are diagnosed with diabetes, we need to monitor that control of blood glucose for the whole year. If we are successful in monitoring blood glucose through behavior change, I mean, that comes at a cost. And if you are not very successful, we move on to organ damage. The main ones are heart, stroke, kidney. The cost actually escalates. So once diagnosed diabetes, you actually the cost actually spirals upwards. So the way we are looking at it is if we can prevent it as much as possible, and allow our bodies to depreciate in the normal sense, rather than fasting, fast forwarding it through fast foods and fast-paced living and all of that. We should be successful. That's the way we are looking at it. The more delay in the onset, the better, because we know once you start having it, then all the costs come in, the personal costs, the family costs, to the employment, and the medicine, and we have to keep you for. It's not that bad, but it's just that you need to be monitored closely so that you can live happily. We've had diabetics in Fiji who've lived 200 years. It's not a dead end. We can control it, just like Dr. Frank. We can treat it. We can control it. That's the positive things we are trying to, but we need our collaboration. We need to work together. We are coming from the medical and government side. We need the collaboration with the community and other stakeholders that we can deal with these two diseases.
Before we wrap things up, you want to say anything, Dr. Underwood?
The key message is TB is curable. If you're in a high-risk group for TB, it's important that you are more aware that that risk exists, and if you have signs and symptoms, present early. If the health facility is not too receptive, ask. I'm at high risk of TB. Please, what can you do for me, or where can you point me towards? You can go to any primary healthcare facility. If you're in Suva, or you can make it to Suva, at the Tamavo Hospital, there's also a TB clinic that's open from 8 to 4:30 on the weekdays. You can come in at any time. You don't need a referral. Latoka and Lambasa also has TB clinics, but they're not open on a daily basis. They run clinics on a weekly basis. If you're a diabetic, because we're talking about TB and diabetes, it's important that if you have the symptoms, ask quickly. I didn't mention earlier, but if you're a diabetic, you have 5 times more likely to die of TB and diabetes. So getting diagnosed early is important. You're also 3 times more likely to develop TB. You're 4 times more likely to relapse after you've been treated. So the numbers are not very good. But it is curable. The key is to be diagnosed early and play your part. We all have a part to play.
Okay. Dr. Zukana, you want to add anything?
Well, that's the message we are giving. We can end TB by 2030, but it needs a lot of collaboration between the medical sector and the community stakeholders.
Okay. All right. We're going to have to wrap things up. It was good talking to you both. Thank you. Thank you for coming to share more on this very important issue. This is a shared commitment by your 2 health units to ultimately eliminate the co-burden of TB and NCD. But then again, the onus is on us to present ourselves early and to take all our medications. Thank you. You're on Speak Your Mind. I'm Louisa. It was good joining you.